Okay, we're good to go.
Okay. Please tell us your name and title.
Hi, my name is Monica Silva, and I am a patient at the Laguna Beach Community Clinic.
What are the circumstances that led you to access care? Can you tell the story?
So, the circumstances that led me to access care at the community clinic were that my children were being seen here at the clinic. They lost coverage of their insurance through a divorce with my ex-husband, and so I needed a place for them to go and seek care. And once I saw the care that they received, I was compelled to join the clinic as a patient as well.
So, how long have you been a patient?
I've been a patient for about a year now.
How would you describe the quality of service you have received?
I would describe the quality of the service at the community clinic to be superior. I think that because they care so much about their patients and they care so much about me, I would rate it very high on the quality scale. I feel like the personal attention I receive is nothing that I've gotten from other facilities, regardless of my insurance capabilities of paying for care or my access to quality healthcare in other facilities. I just felt that if there's anything I need, the clinic will help me get it.
And how did you find out about the clinic?
I first found out about the clinic when I moved to the community 10 years ago. I work in another nonprofit in town, and all of the wonderful things that the community clinic provides for the community, I found out through press releases and other community events. So I've known of the community clinic and I've known of their presence in the community. I just have never been compelled to be a patient until now.
So, what would have happened if you had not been able to access healthcare?
What would have happened if I haven't? Let me start over.
Go ahead.
What was the question again?
What would have happened if you had not been able to access healthcare?
If I
Had not been able to access healthcare.
if I had not been able to access healthcare with the community clinic, I would be underinsured. I would probably have not gone to the doctor or to a clinician at all. I have in the past not seen a healthcare provider for a year at a time. And I know that preventative healthcare is very important, and I know that getting seen is and getting tests done are really important. And so if I hadn't heard about the clinic, then I probably would not have seen a healthcare provider at all. I would have just, 1 year would have turned into 2 years to three, and I wouldn't have been seen at all. So I'm very grateful.
Will you continue accessing healthcare here?
Would I consider, would I continue care? I'm sorry, once more.
Will you continue accessing healthcare here? And maybe like why?
Okay. I will continue accessing healthcare here at the clinic for various reasons. One, the staff, they are phenomenal. The medical director is one of the best doctors I've ever come in contact with. So I believe that I would continue getting healthcare access here for those reasons. Another one would be because of the team approach. I think that it's really important for a patient to get a holistic approach to their medical or for their care, their health care, and the way that the clinic works with other clinicians like mental health or dental. I think that's really important, and so I think that for those reasons I would continue gaining access to the healthcare here.
If you could thank anyone in specific in the organization, who would it be and why?
If I could thank anybody in the organization, I would probably thank the medical director and CEO, Dr. Jorge Rubal. I would also like to thank his right hand, Adriana, and all of the staff that work here. All of the other participatory physicians and nurse practitioners. I think that what they do day in and day out is it's a heavy burden to bear, but I think that it's so important, and the fact that they are willing to step up and do it, I think is phenomenal, and so I would like to thank everybody here at the clinic.
Good answer. What kind of services have been provided to you and what services will be provided to you in the future?
The services that have been provided for me through health screenings have been mental health, dental health. Although I haven't really utilized them, I still feel very comfortable and confident that if I do in the future need those services, I can ask my doctor here or I can speak to a nurse practitioner and the referral would be almost instant. I'm more familiar with the pediatric programs here because of my two children that attend here. One particular incident, my son broke his arm and we had to go to another facility for care for his. Give me a second, but I'll think of it. When they got prosthetics, no. Orthopedic. Think it. My son needed orthopedic care, and the recommendation that was given to us was great. He was taken very well care of, and we couldn't have done it without the help and the guidance from our doctor here, Dr. Ball.
Would you recommend the service you received to a loved one and why?
I would recommend the services here at the clinic to loved ones, neighbors, anybody in the community because of the great care that you get here. I think that the fact that they are here to serve the underinsured, the non-insured, patients with special circumstances or communicable diseases or things of that nature, I think that I would recommend that for anybody looking for great health care and someone who really cares and who will sit and speak with them. Another fantastic thing about having a doctor in your own community is that he really cares and he goes to patients' games and he asks them to see him whenever. My son, who's 15 years old, knows that his doctor, he knows him by name and he has his phone number and knows that at 15 years old, if he needs something, which in his case he probably will, he can go to his doctor and he can just walk down here and walk into the clinic at any time. And for me, that's invaluable. I couldn't get that for any dollar amount that I would spend on insurance anywhere else.
Really good answer. Okay, last two questions. Talk about your experience the first day you walked into the clinic. What were your feelings? Were you put at ease once you received care?
So the first day I walked into the clinic, I felt a little uneasy. I wasn't sure what I was going to expect because at the time I didn't have insurance for my child. I thought that the care would probably be substandard. And the facilities are very humble and they're very quaint. So when we got into the room, she needed to draw blood and I was immediately put at ease because of the clinician that was taking her blood. The phlebotomist was gentle and sweet and made my daughter feel at ease instantly, and before she knew it her blood was drawn and she didn't even feel a thing. So to me, those little things of getting immunizations, getting shots, getting blood drawn, they're very routine for patients and clinicians, but I think that the way in which you do it and the way that you handle someone who's feeling uneasy, I feel it tells you a lot about the practice. And so from then on, we were always taken really good care of, and we always felt at ease.
In a sentence or two, please describe why people should support COCC.
I think people should support COCC for a few reasons. One, you always want to make sure that you have access to great health care and quality health care, no matter the circumstances, to pay. Maybe we have insurance, but maybe we're underinsured. Maybe we have HMO and we're limited to what we can get to. But having this valuable resource of a community clinic, you have someone who really cares about you and knows your story and knows who you are and lives within your community. So they know what you're dealing with, whether it's a hardship or whether it's environmental or familial. They're there to help you, and they know you better than anybody else, any better than a community they know you better than a company would, an insurance company would, or a huge hospital that isn't able to get down to your level.